Hello, and a sincere welcome to all present. My name is Dr. Hastings, and I will be presenting the Wayne State Family Medicine Quality Improvement Project. The title of our project is called POCUS Bingo. This presentation was prepared by myself and my resident colleagues Dr. Jarbo, Dr. Rubin, Dr. Dervishi, Dr. Dehimbo, Dr. Galkin, and our supervising attending Dr. Cox. So let's get started. Point-of-care ultrasound, or POCUS, is a crucial diagnostic instrument that enhances clinical results, boosts care efficiency, and reduces expenses. POCUS is gaining recognition for its diagnostic value across various medical specialties, leading to its incorporation into medical education to improve clinical decision-making. The American Academy of Family Physicians recommends including POCUS training in family medicine residency programs. 2 years ago, we initiated a quality improvement project to establish a POCUS curriculum within the Wayne State University Family Medicine program. This year, our goal is to build on that foundation by increasing participation in POCUS training. We aim to boost residents' comfort with using POCUS for medical decision-making, patient evaluation, and treatment. To achieve this, we plan to implement gamification strategies by introducing a unique bingo card system. Through this system, we hope to motivate residents' engagement with POCUS, ultimately enhancing their confidence in patient assessment and therapeutic intervention. We developed a bingo card consisting of 24 POCUS tasks and distributed it digitally to the family medicine residents at Wayne State University. Each task on the bingo card was either previously taught or would be covered throughout the academic year. For example, the initial didactic session that was held focused on the identification of IVC collapse, lung anatomy, kidney anatomy, and conduction of bladder volume exams. The sessions utilized various instructional methods, including images, videos, standardized patients, and ultrasound models. On October 8, 2024, 22 residents received their bingo cards. Before the start of the bingo card didactic training, an anonymous survey using a 5-point scale was administered. This survey was repeated after the final training session on January 31, 2025. The survey assessed several factors, including prior exposure to point-of-care ultrasound, confidence in using POCUS for a patient evaluation, confidence in performing procedures with POCUS, the number of patients independently assessed, and the number of tasks completed. This is an image of the bingo card used in the study. Quality assurance for exams performed will be per the Rochester Academic Family Medicine POCUS policy, which requires all studies be uploaded for review to the HIPAA-compliant Butterfly IQ Cloud for the principal investigator to review. All procedures will be supervised and assisted by the faculty mentor. As per RAFM POCUS policy, all patients must provide documented informed consent before an ultrasound exam or procedure can be performed. One precepted POCUS exam will count towards completion of that bingo square. Of note, squares with multiple options for completion will be marked complete if one of the exams or procedures is performed. For example, if a resident performed a ultrasound-guided knee injection, they can also cross off knee exam under the soft tissue/MSK. All data from the 22 residents who took part in the study were included in the analysis. According to the pre-residency POCUS exposure survey, 27% of residents indicated that they had no experience with ultrasound. Following the bingo card intervention, nearly 70% of residents reported having 5 or more hours of ultrasound experience. There was a small but noticeable increase in the number of patients evaluated per resident, rising from 2.05 to 2.27. Resident confidence also improved throughout the study. On a scale of 1 being not so confident to 5 being very confident, confidence in assessments increased from 2.55 to 2.77, and confidence in procedures rose from 2.59 to 2.86. Diagnostic confidence shows a slight improvement, going from around 45 to 48%, with one resident reporting extreme confidence. However, due to limited practice with procedures, ultrasound-guided procedures, confidence decreased slightly from 50 to about 43%. Most residents completed at least one bingo square, indicating moderate participation. One resident demonstrated strong engagement by completing all 25 squares. And lastly, the main barriers identified by residents were time constraints and limited skills or knowledge. Although confidence in diagnostic POCUS increased, there was no change in confidence regarding ultrasound-guided procedures, suggesting the need for further efforts focused on enhancing procedural skills. Although the findings were not statistically significant, probably due to the limited sample size in the pilot study, the noted positive trends imply a possible association between POCUS bingo and improved resident skills and usage of POCUS. Future objectives include incorporating additional procedure training sessions, along with more comprehensive diagnostic sessions. This study revealed that adding an innovative bingo card to gamify our POCUS curriculum greatly enhanced resident involvement and confidence in utilizing POCUS for both patient evaluations and procedural tasks. Looking ahead, we aim to broaden the scope of training sessions and boost participation while maintaining the integration of the bingo card. In the long run, this tool could provide insight into task completion and allow us to fine-tune the curriculum by pinpointing organ systems that need further practice. Thank you for your time and attention today. I hope you found this information valuable and you can incorporate POCUS within your patient practice. As always, be well and take care.